I'm Barb Riley, the KDE Hub Scientific Director, and pleased you've chosen to check out this video. I hope you find something useful in it. Systems play a central part in mental health promotion and within the Mental Health Promotion Innovation Fund. The most upstream structural determinants of mental health are all about systems. Also, for interventions to be sensitive to cultures and contexts, there needs to be an understanding of the environments or systems that are relevant to a project. A third reason is that systems change is needed in policies, resource allocation, practices to sustain and scale promising approaches to mental health promotion. We cannot avoid systems. Best we learn to understand them and work with and within them constructively. This video bites off selective parts of learning about systems and how to make them work for us. Its focus is on some tips and tools for identifying and describing systems relevant to mental health promotion projects across the country. I'm the primary narrator, drawing on a recorded interview I did with Dr. Diane Finegood, a leading systems thinker in Canada. The video also draws on a session from the Hub's first annual symposium from January 2021, the session on describing participant contexts. Think iceberg model and Jamboards for anyone who attended. The content covers concepts and practical tools organized into three parts. Part one is background, a bit more about Diane, defining a system, our focus on complex systems, and the added value of systems thinking. Part two is a process for describing relevant systems, deciding what systems are relevant. First who, then what is the main principle we discuss. Methods for describing systems with a focus on the iceberg systems model. The importance of both divergent thinking, so free-flowing with a focus on idea generation and brainstorming, then convergent thinking, so bringing ideas together through sense-making, distillation, and synthesis. Part three is practical tools, tips, and examples. The main resource is a guide to organizing and facilitating a systems mapping exercise. We also include system maps generated at the Hub's 2021 symposium as early works in progress. They remind us not to be scared of a very natural, if messy, developmental process. We also include a few select additional resources. We share several audio clips from the conversation I had with Diane. Diane is a leading systems thinker, actor, and teacher, and a resident expert right here in Canada. I actually love her story. It says a lot about the perspective she offers and her deep engagement with systems. Academic, inaugural scientific director for the CIHR Institute of Nutrition, Metabolism, and Diabetes, executive, research funder, deeply curious, passionate, committed to advancing ways of thinking, doing, and assessing that are aligned with how the world works using a systems lens. Diane started out in a wet lab, understanding systems at a cellular level, and progressively engaged with systems thinking at a population level. Few people develop their passions across such a wide spectrum and in different professional roles. Diane is also a founding member of the Hub Resource Collaborative and was instrumental in helping to position systems thinking and principles as central to the Hub's mandate, goals, activities, and ways of working. As a bit of a warm-up in our conversation, I asked Diane to share why she was interested in having a conversation with me.
Why do I? Well, I want to have the conversation because I'm, as you know, totally passionate about bringing systems thinking to the world, if you will. If we don't start to try to think differently about solving or addressing or working to shift complex systems, working against challenges, complex problems, and shift complex systems, that we're going to be hooped. Like, the world is going to hell in a handbasket. Sorry, it really is, in so many different fronts. And the only way we're going to turn that around would be to think differently. We can no longer think about solving complicated problems, predictable, controllable, designable, with approaches that are good for complex problems. which are unpredictable. I think there's a spectrum of intensity with which we apply kind of systems thinking. I think there's a range of it, and we all should try to go from where we are to where we need to be, because it's kind of at the core of building a sustainable future for this globe, frankly. And I don't mean just environment, I mean all the other wicked problems that go with where we're at today. I'm thrilled to be able to say yes to the things that allow me to bring this set of ideas to a wider range of people.
Like I said, she's passionate and a terrific resource on all things systems. In that clip, Diane also mentioned complex systems. This is the niche of mental health promotion, as described in other Hub resources on navigating complexity. Links to these resources are in part 3 of the video. Diane and I then moved on to some foundational concepts. What is a system, and especially a complex system?
You know, a system is a collection of things that interact in a way. I mean, you can get to the simplest point: people, organizations, molecules, all of those sorts of things, you know, and how we interact with all of the different levels. You know, that's systems generically are these collections that have their own interconnectedness and behaviors as a result of it. But where it gets actually super important now is to make that distinction between complicated and complex in particular, or simple, complicated, and complex, or even simple, complicated, complex, and chaotic. But the big one, I think, is really between complicated and complex. And that, as I said before, complicated problems, complicated systems are predictable, controllable, and designable. So you can make models to predict what's going to happen. You're going to be fairly accurate. Think sending a rocket to the moon. Hard to do, lots of work, lots of expertise needed, but once you've worked out the formula, you're most likely to be successful. Lots of moving parts, but complex is unpredictable, self-organizing, and emergent, right? So here, now it's not a dichotomy. There's going to be a spectrum from predictable to unpredictable, from, you know, self-organizing down to controllable, those sorts of things, right? It's a spectrum. But when you recognize that kind of fundamental difference, it directly says you need different strategies to try to address the problem. And if you use the wrong strategies, use complicated strategies for complex problems, you're going to spend a lot of time working out the causes of a problem, which may not give you the solutions, as an example. Does that make sense?
So the definition of a system, even a complex system, doesn't need to be complex. A number of different interconnected moving parts. A natural question coming from this is, what are the moving parts?
Yeah, absolutely. So people who work and use a systems approach would say things like, you need a common understanding of the system. You need to unpack the system and understand. You might need to know the causal relationships in the system. There are many different ways to understand a system, but the general principle of trying to build a shared understanding of the system is kind of an important element. Sort of unpacking of a particular complex challenge or system helps build a deeper personal understanding of where you sit in the system, what role you might have to play, what things you can do to change the system, and how you might need to work with other people in the system.
I won't gloss over Diane's point about the importance of a shared understanding of systems. It's more profound than it might sound at first, and we pick up on that as we now move into part 2, a process for describing systems relevant to different projects. As expected, there is no recipe, no single way to identify and describe systems. Boundaries are a key concept in systems. But how do we create and understand system boundaries? What are the perspectives and relationships within those boundaries? I kicked off this part of the discussion with Diane by asking her perspective on whether child and youth mental health promotion is a system or a system of systems or something else, essentially prompting her to talk about system boundaries.
Depends on who's in the room.
Oh, interesting.
That would be, so I don't think we need to get hung up on uh, having a generic definition of the boundaries of the system, but who's in the room needs to pay attention to the boundaries of the system that they want to talk about. So, let's not worry about whether child and youth mental health is a system or a system of systems. It's probably both, right? It really is both. But when you're having a conversation with other people who you want to work with on addressing some of the gaps or the challenges in the system you work on creating a framework in which to articulate the work that you're doing, then you need to actually define the boundaries of the system and at what level of zooming in or zooming out you want to be, right? Because that matters. There's no right or wrong answer, but it matters that when you're then working on the system together, trying to build a collective understanding, that you know what those boundaries are.
So, important points. Boundaries are not fixed, and there is no right or wrong. Who is part of the discussion matters most in defining system boundaries. Add new people or perspectives, and the boundaries shift. Relevance to any project or initiative is key. When planning the session on mapping participant context at the Hub's annual symposium, we had to make some decisions about how to organize the session. That meant naming some provisional system boundaries that would help sort people into the small groups. We leaned mostly towards population groups, so early years, school-aged, Indigenous, newcomers, refugees, and immigrants. Diane offered a perspective on this approach.
So again, I would say it depends on the context. It appears that for the work that was done at the symposium, going by early years and the different Indigenous, the different themes that you used, is the logical first place. And I say it's the logical first place because in my vast years of experience, people want to work on the stuff that they're passionate about, and they tend to identify it in those ways. They tend to create their own circumscribed boundaries, if you will, about their interests related to populations, particularly in this kind of world, right? But in a different context, it might be a different choice that you would make, or it might be a mix of choices, particularly when you're at a stage where people are choosing the conversations that they're most interested in having. And again, it depends on context too.
Another choice we made when designing the system mapping session was what structure or model to use. We went with the iceberg system model for several reasons, some of which Diane described. The most basic premise of this model is that an iceberg sits both above and below the waterline. Using the iceberg visual nudges us to consider system elements that are visible or above the waterline and invisible or below the waterline. Visible elements include events and patterns and trends, things like services, interventions, hot topics in the media, and evidence. All the things we can see or observe. Invisible elements, those under the surface, so systems, structures, and mental models, things like social and cultural norms, policies, and deeply held beliefs. Invisible system elements influence what happens above the waterline and have the most leverage for either maintaining the status quo or for generating change in relation to an issue. Being aware of what is happening at these various levels helps bring attention to the most promising leverage points for addressing issues like determinants of mental health.
So in the workshops that the project ran with the iceberg model, that's one framework for trying to unpack a particular system. And it's, I think, my guess is, in my experience is, it's one of the easiest ones for groups that don't necessarily think of themselves as systems thinkers, don't necessarily understand the jargon or all of that, but it's an easy one to kind of get into, because particularly if you kind of think, okay, what are the mental models floating around that drive how our systems and structures behave? What are the things that are visible, the events, the patterns, the trends that are arising from these somewhat more hidden systems and structures, or systems and structures that we as individuals work in a part of, in a segment of, and how do mental models drive the work that we do? So the iceberg is one version. People build causal loop diagrams as another way for communities to enter this conversation. There's a variety of techniques that can do that.
Even though Diane helped to organize the session on system mapping, she was unable to attend it, so brought fresh eyes to looking at the output for my conversation with her. I asked Diane to comment on what she saw. So listen for what to expect in this type of system mapping exercise, and the importance of starting first with divergent thinking and then moving to convergent thinking.
It was a very interesting look, and interesting timing too, because I've been using trying to use the iceberg in more and more circumstances. So it was lovely to see how it was used in such a diverse way, actually, by the different rooms. So what I saw there, as I said already, I'm guessing that the conversation was good, and probably didn't flag much in any of the rooms, that the iceberg was a good stimulus for a conversation about the system, to focus people's attention on the system. What I saw was a range of sort of stickies all over the map, I'll put it. So not necessarily particularly organized yet, but a lot of stickies, kind of reflecting what was probably a divergent and diverse conversation. And really, I would have expected that in this initial conversation, it would be divergent, that most rooms would have a divergent conversation. One group, the group that worked on the Indigenous piece, was so well, like they were so organized, or their conversation went from, if it was at all divergent, went immediately to convergent. And they laid their iceberg out in an opportunities and gaps or barriers way. When you looked through the levels on the iceberg, they all seemed sort of relatively consistent. We're not trying to draw direct linear lines between the mental models and the systems and structures, but understanding that there are these different levels, and trying to think about them in ways in which you can see the flow from one level to another. How is it that these mental models give rise? What are they telling us about the system and structure in place, and where it comes from, and what we might have to change if we want to change it, together with actually changing the structure? So there's a lot of that there, but that was a beautiful, beautiful piece of work that they accomplished in a relatively short period of time.
Diane's reflections on the system maps help move us to part 3 of this video, some practical tools for mapping systems relevant to your work. The primary practical tool is a guide to organizing and facilitating a system mapping exercise. In it, you will find suggestions for who to invite, how to frame what you're inviting people to do and why, a possible flow for a conversation, including ways to ease into a discussion, examples of questions, and possible probes. An interactive template in Jamboard that includes the iceberg model, and some tips for facilitators. Supplementary tools include the output from the system mapping exercise at the Hub Symposium, so 8 maps that mostly include initial idea generation and limited sorting and sense making. There is also a select set of links to other related resources. If you are interested in any of these practical tools, they are available on the KDE Hub website. You will find the link below this video to the specific folder of our resource section. There, you will find a brief description of each tool, how they can be used, and links to them. On behalf of the KDE Hub team, we hope this is a useful resource for you. In moving from concepts to practical tools, we modeled moving from divergent to convergent thinking. To conclude, I take us back to divergent thinking, or at least some bigger picture points about systems thinking and practice that we can perhaps explore in more depth in the future. I asked Diane for any top 3 points she might offer to the mental health promotion community in addition to what we discussed specifically about the value and practice of system mapping. Here are her nuggets of systems wisdom.
That's a tall order, Dr. Riley. I guess, well, the first thing that comes to mind is the concept of capacity and complexity. We haven't actually talked about this concept, but if you generally understand that that individuals matter in a complex system, and that what matters to the individual is that they have the capacity, the agency, the access to resources, all of those things that it takes for them to do the actions that are expected, enabled of them, that to even take the actions to improve the system, but I think is critical when you're kind of thinking about systems and getting overwhelmed, if you will. You can think about it in terms of the individuals that you're trying to potentially support, or yourself. Do I have the things that I need to do what's expected of me? And do I have an understanding and all of that? I guess the second kind of key message would be that building trust reduces complexity. So this is the idea that if I live in a low trust environment, say I was working in the Trump public service, trying to think of a really low trust environment, it would have been enormous, especially if I really cared, it would have been an enormously challenging environment to work in, right? Like that's just crazy, right? And when you try to fix stuff like that, it's a long process. Rebuilding and building trust in a system is hard work. We don't value it. It's critical. It's all about the relationships, as I said before. And then I think the other is just to reiterate the conversation we were having earlier about improving versus proving, attribution versus adaptation, that we need to move, and even transactional versus relational. We really kind of need to shift from those that measuring the stuff that we thought would help us get to where we want to go, and measure stuff that really matters in a complex system. Because if you measure stuff that's easy to count, like in academia publications and presentations and stuff like that, you get a system filled with people who know how to write grants, who know how to publish papers. But do we get a system where real knowledge is mobilized into the communities that need to receive it? No, because that's a relational exercise, right? That's a different kind of thing. So I think measuring different things. Now, this is not easy, right? I learned this business from a workshop that you and I organized, and I don't even want to think how long ago that was, Barb. But we had that session, and we had a speaker from McConnell who talked about the challenge of doing evaluation for accountability and evaluation for learning at the same time. Whoa, that was one of those, light bulb moments for me. And I've been thinking about that ever since.
We end with those pearls of systems wisdom that also convey a healthy humility and awareness about systems and systems change. This video was about how to identify and describe systems relevant to mental health promotion projects. Future ideas and practices related to systems change will build on these first foundations.